Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about how some medications may be ruining your teeth. Before we jump in, if you ever have a specific question about a specific dental topic, go to Google, type in your question, and put teeth talk at the end, and then you'll see an article or video of me explaining the answer. So, at work, when I'm updating the health history and medication list for my patients, oftentimes my patient will say, I'm not taking any medication related to my teeth. And then I'm like, well, actually, lots of medications can affect the health of your teeth and your gums. Also, some medications may interfere with different anesthetics and tools that we use. So that's why we ask you for an updated medication list, so we can understand why your teeth and or gums look like they do. And we can then plan ahead if you need certain dental treatment to make sure you are safe. For example, some medications actually cause cavities. Almost all medications that a pediatrician prescribes to a child, cold medicine, cough medicine, they tend to be syrups with sugar in them and other types of sweeteners, which cause cavities. Another example, inhalers and nebulizers. People with asthma need them to function. They are life-saving, but they can also promote an oral environment that is more prone to developing cavities. So with both the cold syrup medicines for the kiddos and the inhalers for everyone, a quick tip is to rinse out your mouth with water after using them to combat cavities. Next, medications that cause dry mouth, also known as xerostomia. This is one of the biggest, most common side effects when it comes to medications in your teeth. If you start paying attention to the drug commercials on TV, you'll almost always notice them mention dry mouth as one of the side effects. That's because so many medications, both over the counter and prescription, often decrease saliva flow. That being said, some types of medications are worse than others when it comes to causing dry mouth, such as antipsychotic meds, anti-anxiety meds, antidepressants, allergy meds, and antihistamine meds, medications used to control seizures, narcotics, medications that are taken for certain types of heart disease or blood pressure, including ACE inhibitors, calcium channel blockers, diuretics, etc. So that's like almost all medications, right? Almost all meds can cause dry mouth, which can again lead to cavities. So to combat dry mouth and cavities, some tips are: increase your water intake, drink more water, use lubricating mouth drops like xylitol mints or rinses, avoid alcohol, even alcohol mouthwashes. Make sure you are only using alcohol-free mouthwash. Chew sugar-free gum. This can also help stimulate saliva production. The key is to keep your mouth moist. Next are medications that cause burning mouth. Burning mouth syndrome, when your mouth feels like it's on fire, is attributed to a number of situations, including reflux disease, but it's also linked with medications that people take for high blood pressure. There are other factors you'll want to rule out before blaming your medication on this one, because burning mouth syndrome can also be caused by autoimmune disorders, Parkinson's disease, or even hormonal imbalances. Allergies and certain vitamin deficiencies may also be to blame. Fungal infections caused by medications. Antibiotics are a classic example of leaving your mouth with an unbalanced number of good and bad bacteria. When you take antibiotics, they kill all types of bacteria, including the good ones. If this happens, it's a classic recipe for fungal yeast infections like thrush. That's why so many healthcare professionals recommend taking probiotics or eating foods like yogurt if you're on an antibiotic. Next, gum swelling medications. Certain types of medications can actually cause your gingiva, your gums, to grow. We call this condition gingival hyperplasia. With this, the gums grow, spread, and expand. They tend to look bulbous and lumpy along the gum lines. Obviously, this can cause some cosmetic concerns, but it also, more importantly, isn't very healthy because food and plaque can get stuck around them. Some of the most common medications to cause this are the ones that people take for high blood pressure or to control seizures. Calcium channel blockers in particular, however, are most commonly known for causing gum overgrowth. Medications that cause taste changes. This one is especially important to be aware of because say you're having a metal taste in your mouth. Is it a leaky filling or is it a medication you're taking causing that metallic taste? If it is a medication, usually it's an antibiotic. But blood pressure medication can also cause a metal taste in your mouth. And they can also sometimes cause a sour or bitter taste. Other meds, such as those taken for your thyroid, neurological reasons, or psychotropics, can also alter the taste inside of your mouth. The good news is that the majority of medication-induced taste changes are temporary. Not all of them are, but most are short-lived. Tooth discoloration and staining. Some types of medication can cause intrinsic, internal tooth stain. Intrinsic are those that form while the tooth is still developing, meaning it's from medicine that you would have taken during early childhood or even by a mom when she was pregnant, which would then transfer to her baby. Tetracycline staining is a classic example of this. This antibiotic, tetracycline, is no longer prescribed for young children or anyone suspecting they are pregnant. The permanent staining is so severe that extensive cosmetic treatment is usually required to get rid of it. And lastly, black hairy tongue and white hairy tongue. So they are just what they sound like they are. They are tiny little papilla on the surface of your tongue. They become elongated and they look like hair. And depending on what medication you're taking, if there's an infection or which lifestyle habits you have, those papilla can take on a white or a black color. Now, usually something like black hairy tongue is originally caused by smoking, poor oral hygiene, rinsing with hydrogen peroxide too much, or even from dry mouth. But some medications can specifically raise your risk of black hairy tongue to develop as well, such as antibiotics, NSAIDs, and even radiation treatment. I feel like I could go on and with more and more medications and examples of what happens to your mouth from different medicines, this, that. But these ones that I just went over are all of the most common things that can happen. If you are interested in learning more about medications that affect your dental treatment, such as with getting numb, local anesthetic, things like that, let me know and maybe I'll make a video about that as well. And the next time that you're at the dentist, always remember to bring an updated list of your medications so you and your dental team are all on the same page and so they can best treat your individual mouth. I hope this video helped you. Please like and subscribe and turn on your notifications if it did. Find me on Instagram @TeethTalkGirl. And until next time, peace, love, and teeth.